In our presentation, we will be discussing interprofessionalism between a dental hygienist and a registered nurse. Interprofessional collaboration has been defined as a partnership between a team of health providers and a client in a collaborative and coordinated approach to shared decision-making around health and social issues. Our lesson plan with our target audience consists of a 30-minute presentation discussing the nurse's role in assessing and maintaining the patient's oral health. Our teaching method was supposed to be us meeting up with the registered nurse and discussing the reasons why it is so important to provide optimum oral hygiene for their patients. However, because of the circumstances that's happening, we decided that it would be best for us to do a Zoom call with the registered nurse, which consisted of a 15-minute PowerPoint lecture, as well as a video discussing proper oral care, as well as discussions consisting of risk factors associated with poor oral hygiene and optimal oral hygiene interventions for the patients. We included some interactive activities with the registered nurse that consisted of 2 case studies and a quiz to test the nurse's knowledge about oral hygiene, as well as a pre and post survey. The pre and post survey consisted of the same questions. We had the nurse fill out the pre-survey before we began our presentation just to see what knowledge she has about oral hygiene, and then we had her fill out the post-survey after our presentation to see if she benefited from the presentation and if she was able to answer all the questions correctly. Registered nurses are the largest individual group of healthcare providers of Canada. The main nursing duties include the promotion of health, prevention of illness, and the care of ill, disabled, and dying people. Registered nurse practice consists of diverse yet interrelated domains of activity, including clinical practice, education, administration, and research and policy. All registered nurses, registered practical nurses, and nurse practitioners practicing within Ontario are members of the College of Nurses of Ontario. Nurses provide, supervise, and remind or cue oral care for clients at least twice daily on a routine basis. They provide ongoing education to the client and family members regarding oral care, as well as supervise the provision of oral care for clients at risk for aspiration. Nurses are knowledgeable of oral hygiene products and their applications as they pertain to their specific client populations. They are aware of treatments and medications that impact the oral health of clients, as well as use appropriate techniques when providing oral care to clients. Nurses advocate for referral for those clients who require a consultation with an oral health professional and ensure that all oral health related history, assessment, and care be documented. Nurses require appropriate oral health knowledge and skills acquired through entry-level nursing education practice, workplace orientation programs, and ongoing professional development opportunities. They provide oral hygiene care to their clients either directly or indirectly and must participate in and complete an appropriate oral hygiene education and training.
We educated the registered nurse on medications and their effects on the oral cavity such as xerostomia. Dry mouth is a common side effect of many prescription and non-prescription drugs. We spoke about dry mouth along with products that will aid in reducing xerostomia. We educated the nurse on proper modified Stillmans, proper C-shaped flossing, and different ways to modify a brushing technique if someone has mobility issues, for example using a long-handled brush. We also talked about guidelines on how nurses can provide optimal oral care on an unconscious client. We were able to ask questions so that we were able to obtain information regarding the approach and provision of oral healthcare services to the following clients. Clients with diminished health status, decreased level of consciousness, limited dexterity, individuals with physical, developmental, mental, sensory, behavioral, cognitive, or emotional impairment, and the residents of long-term care homes or individuals with dementia. We also spoke about individuals with particular health conditions as stroke survivors receiving chemotherapy or radiotherapy. We played a video that showed step-by-step on how extra and intraoral is completed and the importance of it. She really liked the video and understood why it's important to do extra and intraoral examination to monitor the changes in the patient and check if they have any suspicious lesions or bumps. After the video was completed, we asked her if she remembered the steps for intraoral and sent her the image here so that she has that to reference to. The only changes to her post-survey was that now she strongly agrees that her knowledge in dental hygiene is excellent. On her pre-survey, she first checked marks, somewhat agreeing. All the other questions stayed the same. She strongly agrees that the oral and general health relate. Oral may improve the quality of life and overall health. Visiting the hygienist is important. Oral hygiene education is important, and brushing and flossing can improve oral health. Before giving her the quiz, we defined a few terms that she wouldn't know of just so that she has more information and be able to actually answer the questions. She did a great job and she got all the questions right by critically thinking. We didn't need to help her during the quiz, but after it was completed, we explained why her answers were correct in more detail just so she has more knowledge. There were 2 case studies that we gave her to do, and we did them collaboratively just because the questions were complicated for her to do alone. We explained the questions in detail, and if the answers didn't make sense, we also simplified it by wording it differently and defining the terms. Overall, she did a great job. We explained why the answers she got wrong were wrong, and the answers she got right, we also explained on why it's the best answer of the options. One of the questions asked about a diabetic patient, and she related that to her work and compared the oral symptoms that diabetic patient had. There were plenty of questions that were asked by her. For example, she asked what is plaque, what is calculus, what is xerostomia, questions similar to those just so that she has more information. And when we were doing the case study, she didn't understand a few terms, which we did explain in detail, and it helped more in her knowledge. Overall, the presentation went very well. She told us that she enjoyed our presentation, and we were even able to talk about our personal experience and her experience with her patients and their relation to oral health as well. At the end, she felt like she had more knowledge and that she was interested in learning more.